Hello, and welcome to the return of Bond Air. I'm your host, Jesse Longo, the Associate Director of Nursing here at Bond. I'm so excited to be back in the podcast booth. We've relocated to our support center office here in Chelsea, in Manhattan. We're so excited to get things up and running again. We are joined today, or I'm joined today, with Dr. Gabby Fottle, Senior Director of Medical Programs and Projects at Bond. Hi, Gabby.
Hi, thanks for having me.
Thanks for being on again. It's great. I feel like we got the dream team back together as we started the podcast, 2 years ago now. We're continuing, which we're so excited about, to have these conversations with vet professionals and folks across the industry. A plethora of topics, anything from clinical team care. Today we're talking about palliative care, which we'll get into, types of cases, all of that good stuff. So stay tuned and subscribe to us on your favorite podcast platform as we get going. So without further ado, today we have an exciting episode where we're going to be diving into the topic that many pet parents face, but few fully understand: palliative care for their beloved pet companions. Joining us is Dr. Stephanie Silberstang from Gentle Journey Vet Care. Steph is a highly experienced veterinarian with over 10 years in ER practice. She's a graduate from Cornell University and a member of the AVMA, Fear-Free Certified, and a certified peaceful euthanasia veterinarian. She's also trained in veterinary acupuncture, bringing a holistic perspective to her care. Today we're going to explore the ins and outs of palliative care, what it is, how it differs from hospice or general practice care, and why having a palliative care specialist can make a world of difference in the pet's quality of life. So we'll also address some of the difficult decisions pet guardians face when considering treatments and interventions, and how to know when it's time to prioritize comfort over aggressive care. Thank you, Steph, so much for joining us.
Thank you for having me back.
We're so excited to have you here and to talk. A lot has happened for you in the last 2 years.
That's right.
You have Gentle Journey Vet Care coming up with, I think your kind of personal, life goal with creating this service that you're providing for everybody. I think we could start out with kind of the biggest question that comes up when I'm sure you're talking about your practice with pet guardians. What is palliative care?
Thank you for asking. And I would argue everyone has this question, even veterinary medicine professionals. Palliative care is the treatment of a disease process that can be curable or incurable with a focus on pain management. And so I think a lot of people hear palliative care and automatically go to hospice, death. I would argue palliative care is about life. And so most of my patients, we're focusing on quality of life, prolonging quality of life, prolonging good life. But I've done palliative care for anything from terminal cancer diagnosis to a space surgery. You know, when people just need extra support, this is why I started Gentle Journey Vet Care.
I love that. I feel like that is, again, I mean, there's so many spots of veterinary medicine that kind of get either overlooked or pushed aside because we don't even realize that we're kind of doing it most of the time. So having kind of like a dedicated system and practice in place to be able to provide that for the pets that you're able to serve is super exciting. I'm sure you've had a pretty awesome reception so far. Yeah,
I started just March 1st, but I've had this idea essentially since I did my own dog's hospice care. I know that Dr. Fottle went through something very similar. I'm not sure if you've had an experience like that, but when you're caring for your own pet, you need a lot of support. Even as a veterinarian, I needed support that I did not get, and I saw a gap that needed to be filled. And I always describe it, specialists, they are busy and we want them to move through cases quickly so that we don't have to wait 10 weeks for an appointment. And your general practitioner oftentimes has 20 or 30 minutes for you. And so where I come in is support between those moments. And I find that a lot of caretakers really need that. Caregiving is hard. I'll say it again, caregiving is very hard. And so I'm there to support both the general practitioner, the specialist, and of course the guardian in, kind of taking a big step back and considering the entire pet and all of their care. So I'm really excited. It's going very well.
Awesome. Well, I think some of the like biggest questions that come to mind, especially as you're starting to kind of describe the services that you provide and what your experiences have been in the past, is kind of like differentiating kind of the concept of palliative care from either hospice care or even general practice care that kind of our vets are providing at Bond.
Yeah, and I'll even add to that. I feel like as a general practitioner myself, I hadn't really talked about palliative care much at all, especially when I'm dealing with these patients that have a laundry list of different issues going on. And it is time consuming, like you said. And so I think having for our pet parents, having a team of veterinarians that can really fill in all the different needs for our patients is really such powerful stuff. And so I love that you really partner with the vets to provide this holistic care for the pet, which is awesome.
Thank you. That's exactly right. I always describe it as I'm joining the care team. Thank you for letting me join your pet's care team, because it's true. 100% of my patients still have a general practitioner. Many of them still have a specialist. They have a groomer, a trainer, a physical therapist, and me as an acupuncturist or another acupuncturist. And so I am truly joining a team. So I'm there to support everybody. And Jesse, you had asked me a question.
Sorry, I interrupted there.
You did.
No, it was great. I loved it.
I wanted to know kind of like from your perspective what the differences are between
yes. Thank you for
GP
repeating
and
that.
palliative care, of course.
So I would say palliative care is an umbrella. Absolutely, hospice falls under that. Pain management falls under that. For me, quality of life, both for the caretaker, caregiver, and the pet. As far as GP, Gabby's saying that, you're not necessarily considering it. The truth is you're probably providing palliative care, right? You are identifying pain every single day. You are treating it. You are diagnosing diseases and providing appropriate therapies. And so our GPs are doing palliative care, but not necessarily making that differentiation. I think a big distinction for me is that a lot of my patients, especially at least New York City based, they don't want to go to the vet anymore. Yeah. They don't want to go into the vet. And that is something we could provide to them. I provide in-home care. But, there's certain things I can't do. X-rays, dentals, that's Gabby's jam, surgeries. And so hospice is when we are choosing to no longer pursue interventional care. And there are hospice programs in the U.S. for veterinary care, and they kind of require you to no longer pursue hospitalization, surgery, chemotherapy, and treatment. It is truly just pain management and end of life, and so I do provide that. For me, I like treating, I like continuing care, and so a lot of my patients, they're welcome to pursue, their pet guardians are welcome to pursue continued care, and I will support them through that.
Awesome. I think that was like a kind of a perfect summary in my head of kind of what that looks like. I think as we continue on to think about even what best practices look like for palliative care in either, again, your services that what you're able to provide at home or that we're able to provide within our clinics for our clinicians.
Yeah, absolutely. And, we work together. So I oftentimes go through the whole pet's care, diagnosis, treatments, what's working, what's not working. And I communicate with the GP and say, hey, I think we could consider, what do you think about trying a higher dose of this or switching the medications to this? Could you, next time they're in the clinic, get urine to make sure we're not missing X, Y, Z? And so it is sort of a collaborative approach.
Yeah, I love that. I think what I was going to kind of ask was, as a referring veterinarian, if I'm sending a pet to you that I believe can benefit from additional support from you and your team, how does that look like for the referring vet side? And what can we let the pet owner, the pet guardian, which I love that you use that term, what can they expect from the appointment? How do they prepare for it? What kind of questions should they ask? Just to manage expectations. I think with these pet owners or guardians, as you mentioned, they're going through a lot. Yeah. They're very busy, stressed, oftentimes anxious. I certainly know how that feels like for my own pet's care. So just having a bit of understanding of how the appointment will look like, do they need to do anything to prepare for it, I think would be really helpful from the referring vet side, so that they know what's going to happen during the appointment.
Yeah, thanks for asking. Yeah, so I start everyone with a virtual consultation, and I have clients all over the country. So anyone can refer to me. And the way we do that is I get all the medical records, and I do ask them to fill out a form. It's a form that's pretty comprehensive as far as appetite and thirst and urination, but it also includes questions like, what does your pet love? What would a perfect day look like for your pet? You know, are there things you haven't done with your pet that you want to do?
I actually saw you have like a bucket list package.
Yeah, we're going to launch a bucket list package probably for the 1 year anniversary of Gentle Journey Vet Care.
Spoiler alert.
Spoiler alert.
It's on the website.
Yes, we're working towards it. And you know, it's really supporting these caregivers in making sure that their pet's care is everything they want it to be. And I think a lot of people are feeling like it's not. So when you're referring to me, we do that list for pets that are experiencing mobility concerns, which is, you know, the second leading cause of euthanasia for dogs in the U.S., second to cancer. I do also provide a pain assessment, and that allows us to follow up in the future as we start things to make sure that they're actually responding well to it. And so when you're sending them to me, they get a couple forms. I look through their records, and we sit down for a 45-minute consultation and discuss everything. We go through medical history, medications, what's worked, what hasn't worked, what's not going to work, you know. I think a lot of times there's a compliance issue we assume is the pet guardian, and I very much recognize it's our job to help with compliance. So palatability, you know, how are these cats that are on 13 medications going to take that medication? And is that guardian chasing their cat around the house and they're ruining their relationship with that cat? What is that quality of life for them together for that relationship? And so to answer your question, when they come to me, I need the records. They do the form, but I don't want to put too much on them. I think when they come to me, they're already feeling overwhelmed and they have too much on their plate. And so I lay it all out. That summary, all the recommendations we come up with, once we talk about what will work and what we want to try, that all goes back to you as a general practitioner, and you're welcome to pursue that. You know, if I'm recommending Librela or a change of NSAID therapy, you can then connect with your client and go ahead and do those things, and then I'll touch base with them. Hey, how are things going? Because you might have a time for a phone call, but the little, you know, a day of soft stool or a vomit here and there, you might not have time to reach out to them. And so I support both of you by bridging that gap.
I love that, because the vet oftentimes feels overwhelmed, just like the client does. And we're all tired.
There's not enough of us, and you don't have enough time in your day.
Totally.
Even, you go to look at this patient, so you have to pull up the previous record, and it's like, okay, what didn't work, what did work, and I could basically hand that information to you to make sure that you feel supported in caring for your patients.
I love it. Yeah, it's so obvious to see the need for something like this in our industry, and I just feel like we're not talking about it enough.
Yeah.
So I love that that's something that you could provide for our vets, and you don't physically have to be there, which I think is one of the coolest parts about it, is that you could just get on a video call from the comfort of the client's own home. You can kind of see the pet in the background sometimes doing their thing.
People always show me the pet. I'm like, I see an ear go by, and I'm like, let me see them, or I'll ask for a photo because I like to see them.
Yeah, of course.
Yeah, I think accessibility to care is something that it was brought up in the last conversation that we had.
Spoke.
It's something that I think across the industry there is varying focuses on how that kind of comes into play. So being able to think about it, especially at such a stressful time in a pet guardian's kind of life with their pet, having that accessibility is so key to be able to really provide that comfort and that care both to the pet owner and the pet. Yeah.
And that's why I say it's truly customized, personalized care, because what works for one pet or one guardian is not going to work for others. And we need to it's very collaborative to figure out what is going to work. Saying, okay, go ahead and do this. They're going to go home. It's going to fail. They're not going to feel supported. And so we sit there and decide together, what is going to work. And we have that time, which is the luxury of palliative care, I guess.
Yeah, absolutely. Especially I think when so often through a client's journey, they feel like either rushed or kind of, especially in this point in life, when they're feeling they want as much time as they can to either decide on something or move forward with it. I think as kind of telemedicine and other kind of types of practices continue to evolve, that like stress on a veterinarian to feel like they have to do everything in the room in whatever amount of time that they have, it starts to become relieved with practices like yours and other options that exist out there.
Yeah, exactly. We've all been there when it's like, this pet has 15 things and I have 30 minutes and I would love to talk to him about X and Y and Z. You just don't have the time. And so I think a relief is a nice way to put it for everybody involved.
Yeah.
This might be a hard question, but how do you recommend veterinarians talk about palliative care in a way that is not associated with something negative? I think when we talk about palliative care in humans, it automatically you're implying end of life care.
Yeah.
And so I thought the example you gave, that like just management after a spay where you have to keep this hyperactive pet restricted and not busting open all their stitches, and considering palliative care for that is something I've never considered or thought about. But I feel like a lot of times when we talk about palliative care with owners, they're like, oh, what do you mean?
Yes.
My pet is fine. What are you talking about? And so what are some talking tips that you think would be helpful for the vets as we start talking about palliative care in our everyday practice?
That's a great question. I think more education around palliative care in general is going to be helpful. But I think the word itself can be triggering. So I often use pain management or case management or introducing the word palliative care with a recommendation or a description. But that's a very good point. It can be very triggering to people, and they very generally associate it with hospice. And so I usually just phrase it as, we're going to spay Fluffy, and, she's not good with a cone, and we're worried about medications afterwards. And so I think you probably could use some extra support during this time, reaching out to a vet who can help you with that, and then kind of introducing palliative care. That would be palliative care. But it is a very triggering word, and I do think we need to kind of move around it. Yeah. I also think if you have a pet with a terminal diagnosis, even mentioning hospice is really hard, saying the words, the end of life is coming. I think that's still hard, and so introducing it very gently, usually by saying, I think you need more support, and there's someone who could provide that to you. The words are going to come up eventually, but it'll help ease them into it, I think.
Yeah, and I think what I've found too is just calling out. you're dealing with a lot. You're doing great. Gets you very far with a guardian. Yeah. And saying you're doing a lot. It looks like you need help, and I would need help too. I've been there. I've experienced this. I know someone who could help support us here and be a member of our team here for Fluffy. So I love that.
Yeah, that type of communication is like so key to even just like gaining compliance to call you and to like kind of understand like it's okay to ask for this type of help. It's okay to like, I think so many times owners feel like, especially in this period of like guilt or like not doing enough or not doing the right things. But I think it's something that we kind of like think about too, even when training our new graduate doctors here. We think about like communication and how we can kind of make sure that is a connected and human, transaction that we're talking about, and like being able to relate to our clients in that way is so important because it makes everybody kind of like it de-stresses, and it continues that relief along through it.
Well, that reminds me of a callback from our last podcast that the three of us did together with Dr.
Greenhill.
Lisa Greenhill.
Yeah.
Greenhill. I was going to call her Greenfield. Dr. Lisa Greenhill is fantastic. And, we talked about the gold standard and how the gold standard needs to change from all these diagnostics and a lot of very expensive things to empathy. And I definitely lead with that. And I think a lot of us try to.
Chills.
I know you got chills last time. I think you got chills last time. The gold standard being empathy. And I think that for new graduate doctors and things like that, it's really important to express those things. Our job as veterinarians is to support the clients for their pet. You know, it's not, we don't make decisions for them. We provide a lot of information, we provide choices, and then we should be willing to support them in those choices. And I think that that is the gold standard of empathy, you know, and moving away from things like, well, they didn't want to do these things, or, you know, they can't get the meds in the pet and things like that. And moving towards, okay, you can't get the meds in Fluffy, what are we going to do? You know, and I think most of us are pet guardians already, so we could relate to it. And unfortunately, everybody will be in a tough spot at some point. Everyone's going to have a very personal experience with palliative care, a very personal experience with hospice at some point. And so hopefully leading with those experiences. I find that like pet guardians really appreciate when I say, I've been here, you know, like Abby said, I've been here personally. It sucks. And let's move on and provide the care that they need.
Awesome. Well, I think we have, speaking of pet guardians, I think we have a couple of questions that Gabby
There was
collected.
a really great question that a pet guardian sent in that I thought was awesome. And I struggled with this when I had to say goodbye to my last dog. And it wasn't just me. It was me plus my entire family. It was my childhood dog. Everyone had different thoughts about what he needed and if he was comfortable. It's, you know, well, he's not really standing, but I don't think he's in pain. That was the kind of, well, what do you mean? Of course he's uncomfortable. And so I think when we have a lot of analytical people who want to have a formula, right, or have some sort of way to evaluate their pet's quality of life and when to say, okay, enough treatments, enough surgeries, enough chasing the cat, pulling them out from under the bed to pill them with medications that taste awful. When is it time to say, let's just focus on our pet's quality of life and happiness over all of these things? Because both of us are struggling, right? The team is struggling, the parent, the pet owner is struggling, the pet is struggling with their relationship with their pet parent. And so when is it time to say that's okay and the owner feel okay that is enough and not struggle with the kind of guilt like Jessie was talking about before?
Yeah, well, I love this question, and I'll tell you, guilt is an enormous emotion. It's a huge part of anticipatory grief. I bring up anticipatory grief all the time. It's grief before your pet has passed, and a lot of us grieve heavily.
I have that constantly. Like, I just look at my
with
cat.
A healthy cat.
Yeah.
A healthy cat, you are like, one day they're going to pass. And when your pet gets sick, that is really, really heavy stuff. And so guilt really plays a big role. And that's really hard. You know, we need to make sure, first of all, that our pet guardians have all the resources that they need. They need a support system, and that could be family. If family's all involved, you know, they need someone else, and that could be therapy or a support group. There's a lot of pet grief support groups for anticipatory grief. To answer your question, how do we know, or when is it time? It is a very personal choice. That choice is so very personal, but, you know, that's where I kind of try to customize it. Are you a numbers person? Can you look at your pet every day and give you a 1 to 5 value and just stick the numbers on there, and we can look at it in a week, 2 weeks, a month? Could we put a calendar on the fridge and you do happy face, sad face at the end of every day? How did your day go with your pet? Do you feel generally like, whew, he had a good day, smiley face, you know? Or I just did a behavioral consult for my own pet, and they wanted me to do red, yellow, green. Things that are highly visual or very, you know, we're so telescopic. Is that a word?
I think so.
We're so telescoped in,
yeah.
especially when you are the caregiver. You are like microscope on this pet. They puked. Okay, we didn't get the meal in. We're on the next meal. But when you take a really big step back, I think that could help. A lot of times I will recommend comparing your current pet to a pet 2 months ago. You know, seeing that contrast. I think if you can go back in time, put them next to each other, you'd be like, this is a very big difference. Because a lot of times we don't get that step back. but it is such a personal choice. It can be really, really hard. I support, the decision to end a pet's life, usually at any step of the way, because I think some of us feel like they need to be sick or dying. And your pet will experience that. They're going to experience the feeling of being sick and dying. And so if you say he has a diagnosis, he is going to pass, and I never want him to feel that way, we could let them go before they ever experience a catastrophic event that honestly is going to stick with you for a long time. And some people need that catastrophic event. And so there are quite a few scales and measurements and things like that. I usually talk about lines that we're going to draw. If he can't walk, is that something that you feel like that would be it? And if they say yes, and then eventually this pet can't walk, we're going to bring that back up. You said, and they could change their mind.
Yeah.
But, we had talked about, if he loses his mobility, that is so important to Fluffy. He loves walks on the beach. If he can't walk, is that affecting his quality of life? And so, not to directly answer your question, but it is very customized for a person, very personal. And I would say it's probably the hardest answer to give. It's the hardest. But I usually try to work with them on, if these are his 3 favorite things and we're losing those, we start thinking about that. Yeah. It's also, I started using the phrase, I want to give you permission to stop. I think a lot of people feel like stopping is failing the pet, is giving up on the pet. And to me, and I was doing an in-home euthanasia the other day, and a client said to his wife, who was having a really hard time, he goes, "This is part of the care." And I thought that was so beautiful, because it's like, you are still this is part of providing exceptional care, which you've done the whole way. The euthanasia is part of the exceptional care. It is not giving up. It is not quitting. And
I have chills again.
He gave me chills. I thought that was so beautiful. We learn from our clients, and I heard that, and I was like, wow, to support his wife, his partner in that, I was like, that is so true. This is not giving up. It's not quitting. It's literally, and there's all the cliches and the euphemisms, the gift of euthanasia, but to give them a good death.
The literal translation.
The literal translation, to give them a good death, that is part of the exceptional care.
Yeah, and giving the permission, I think, is really powerful stuff. I mean, clients, pet owners, parents, they need that validation that it's okay. And
it's okay.
I don't think we offer that enough at times. And so having that, I think, will be so meaningful to so many pet parents, pet guardians, for sure.
And that's also, supporting a GP, you get the conversation started a lot of the times, or I'll get the conversation started, but they very much trust you. We want to refer back. Why don't you go ask Dr. Fottle, what she thinks in this moment, and you'll chime in with, how you feel about how the pet's doing and things like that. And that's also a care team thing, that hearing it from multiple trusted voices can be really supportive.
Awesome. Well, any final thoughts as we kind of wrap up here?
Gentle Journey Vet Care. You can find me at gentlejourneyvetcare.com or at Gentle Journey Vet Care on Instagram. I do want to encourage, this is for a lot of pet professionals. We need help too. And I want to encourage you, if you need help with your pet, to reach out. I think experiencing palliative care or hospice care or whatever it may be, pain management for your pet, having another voice on your case, it's really hard to be our own vets. Reach out, and experiencing for yourself can really help you then communicate it to your clients and understand how that could support you in your practice.
Love it.
Yeah, I'm really excited to have you as an option. I've already sent you a couple of my patients, but really excited to get the word out there, and hopefully you'll see a little bit of a bump in requests for help.
Thank you.
And hopefully in some of the places, where folks are listening to this, they're veterinarians that are kind of like have been on the same journey that you have been on, Steph, of like feeling like this is, an unmet need in the communities that they're currently practicing in. If this kind of inspires them to either go out and do something similar, or
Yeah,
even just
get
kind
out
of like
there.
provide, that type of care in their practices. I think it's a really awesome thing to start seeing out there.
Awesome.
Awesome. Well, without further ado, that's going to wrap us up for our next episode of Bond Air. Thank you again, Steph and
Thanks for
Gabby, for
having me.
being here. I will be talking to everyone very soon with more and more guests as we continue this new season of Bond Air. So everybody wave goodbye. Bye.